Good day, dental professionals. Welcome to the Dental Flow podcast. We are dentistry's go-to resource for insights into the business side of dentistry. Your host, Benjamin Suggs, will be helping you navigate through the currents of the ever-changing dental waters. This podcast is packed with innovative practice growth strategies, actionable insights, and expert advice, all tailored to help you elevate your dental practice to the next level. If you're ready to dive in, so are we. Let's get into the flow.
Hey, everybody. Welcome back to the Dental Flow podcast. As always, I'm your host, Benjamin Suggs from Flow New Patient Marketing. Today, I have a special guest. Our guest is Dr. Martin Rabinovich from MHR Ortho in Shrewsbury, New Jersey. Dr. Rabinovich is a board-certified orthodontist. And Dr. Rabinovich, welcome to the show. Thank you for joining us.
Thank you, Ben, for having me. I appreciate it. I appreciate you taking the time to, have a nice chat.
Yeah, absolutely. Thank you. So why don't you just start to tell us a little bit about yourself and your practice?
So I am a New Jersey native. So I was born in New Jersey. I was raised in New Jersey. And what we're going to talk about today, about my startup orthodontic practice. It's locally in New Jersey, in the area that I grew up. A little bit about myself. I'm actually a identical twin. I have an identical twin brother who, coincidentally, so he moves the big bones. He's an orthopedic surgeon, and I get to move the small bones. So, we're very alike in all different kinds of ways, but we're very close. It's a very special relationship. And funny enough, I became a father recently to newborn twins. They are going to be 5 months tomorrow. So we are twinning here big time. I'm a big, aside from being a fan of creating beautiful smiles and healthy teeth, I'm a big hockey fan. I'm a big New Yorkers fan. I played ice hockey growing up, and, watching the NHL playoffs has been exciting recently. A little bit more about myself. I love to travel any chance I get, any free time I have away from work. I always like to travel with my wife, with my family, with my friends. So that's important. Although it's been put on pause with the newborns, but we'll try to finagle out of it at some point.
Yeah, I was going to say, you should say you loved fat past to travel, at least for a little while with newborns. But that's amazing. So do you know, is it more common for twins to have twins, or is that very, very rare? Have you really looked at the math?
I heard different things. I heard, it can skip a generation. I heard that it's only from the mom side, but hey, I guess it's from the dad side too, right? So yeah. I can't complain. I'm loving it.
That's really cool.
Not loving this. Other than that, everything else is all good.
Well, congratulations on having the young ones. That's really a cool experience for you. And it's even more fun when you're running a successful orthodontic practice at the same time. So.
Yeah.
Well, let's dive right in. So I'm excited to have you on the show. We've known each other for a few years now, and I've always been very impressed by you and your practice and what you've done. And just tell me a little bit about when you started your orthodontic practice, like what did you know that you wanted to do differently in your practice based on the other practices where you had worked as an associate prior to that?
Sure. So your typical orthodontic setting is usually an open bay concept, where with orthodontics, you're able to see a lot of patients at once. So depending on how many chairs you have, you usually have several assistants that can do a lot of the work for you. You're seeing multiple patients at once. So the offices where I used to work, it's an open bay concept, and you're seeing a lot of people at once. It's makes it a little bit more challenging to have that patient-centered approach. When I started my practice 3 years ago, well, it's 3 years from February of this year, I wanted to do something different. I didn't want that traditional orthodontic model where it's kind of like, quote unquote, like a mill. I didn't like that feeling where you're seeing people at once and you can't dedicate your time and your knowledge for the patient. And at least from my personality, I'm very patient. I love to explain things. Sometimes I can get a little bit carried away, but I want to make sure that whoever I'm treating, they are at the most comfortable in the chair. They feel at ease. They know every step of the way. And with my approach at my office, there is no open bay concept. You're not seeing, 5, 10 or more patients at once. It's individualized. It's personalized care. So we have separate rooms for each patient where we're going over sensitive information. We're going over sensitive things. And I think it's important that you dedicate the time to listen to the patient and to have a very informative conversation with, and it's tough to do that with your typical orthodontic model.
Gotcha. And one of the things I like to do when I have someone on the show is look at their reviews. And I did notice a trend in like your reviews of parents saying that what they really, really appreciate about you is that you're never trying to rush kids into treatment, just do treatment. Like you're always conservative and more like pushing on the timelines that's best for that kid. Can you talk a little bit about that?
Sure. And that's kind of my philosophy here, where I like to, again, patient-centered, and I keep it of a more conservative approach. The beauty with orthodontic treatment is that you can do that. It's not where it's, you have a active infection, or it's a significant injury, or it's on the spot type of stuff where you have to make a split second decision. With orthodontics, beauty about it, it's a journey. It takes time. So there's different modalities and there's different ways that you can work the case. And how I like to do it is, take it step by step, play it conservative, focus on what the patient wants versus what I want. I want to make sure, part of, or what's one of the most crucial pieces of information that you can have, especially from adult patients, is their chief concern. What the patient's chief concern is may not be your treatment goals. So you want to make sure everything's aligned. So I think it's important to take a step-by-step approach. And with orthodontic treatment, you can even kind of do what's called a therapeutic diagnosis, where you can go a certain way, see if the patient likes it, see if this plan is working for me, and we can always review the progress. And if we want to pivot and go a different direction, we can. So I think that's an important advantage that orthodontics gives you.
So, Dr. Rabinovich, you said, I think you opened your practice 2 or 3 years ago. Is that correct? So, if for other dentists out there who are opening a brand new orthodontic practice from scratch, like you did, now that you've done it and you're a few years into it, is there anything you would go back and do differently if you had to do it over again?
If I had to do anything differently, with my approach, again, I take things a little bit more conservative, if you will. So I didn't really do a full out build out, nor did I, buy an existing orthodontist out. It was kind of somewhere in between, where I got I fortunately found an existing dental space. And so it was pretty much like a plug and play. It was ready to go, and I tweaked the space a little bit. So I customized it to how my office is now, where I bought all the equipment, I painted it, I made it look how I wanted to aesthetically, and I was off. So if I was to go back, honestly, I would not do anything different. It was executed. I loved it. Yes, it does have its negatives, where, let's say, if you are doing a full-on build out, you have more time to plan things, where you can market before you open. I think that's something where, could I have done that differently? Sure, but it would have been tough, because by the time I got the space and created my business entity, it was game time in 2-3 months, and you have so many other things that you have to do to get up and running. It's a little bit of a unorthodox approach, but I think how it went was as smooth as possible, and I really like that approach, looking back at it.
Yeah, I could see. I mean, I've opened a lot of dental practices with doctors, and I've seen the reverse of that, where we had a lot more time and we started marketing early, but then something in construction took longer, and the pieces didn't fall into place. And we've even, we learned years ago, we sent out a bunch of mailers for a doctor prior to getting the certificate of occupancy, and we never doing that again, because we learned that CO doesn't come through. And there was another month or two added on. And it was just, so I think both ways there's downsides any way you go. So
yeah, it's never perfect. It's never perfect. There's always going to be some type of, compromise or hiccup. I can't say it's going to be 100% smooth, but yeah, certainly, definitely with a full-on, full-scale build-out, yes, I feel like you always have to expect some type of delay in anything.
Gotcha. Cool. So tell me about, it seems to me, I mean, in the last, 10 years that patient financing has become some sort of critical part of orthodontic treatment that, if you're not offering options for people to be able to pay for these things in monthly payments, whether it's a parents who know they have multiple kids they have to put into braces or a busy adult who has to, make those trade-offs of do I spend money on this or I spend money on something else. Talk to me about how important financing is and options for your patients in your practice.
I think it's very important. I mean, a couple things to note. Number one, I mean, this is kind of like the economy that we live in. It's a monthly economy. Whether you buy, your cell phone, your car, uh, mostly everything is either subscription based or it's a monthly payment. So that's kind of how, especially orthodontics has become. Because this does take time. So a way to make you different and increase your patient acceptance is to offer financing. But at the same time, I do think it's important. It's something that it's not cheap. It's a big investment. I think it's a great investment. You're investing in your health, in your well-being. You're investing to be more confident. You're investing to have a nicer smile, which goes such a long way. This is priceless. And yeah, I think it's important to offer flexible financing in any way you can. I mean, you can do it in the office and work something out with the patients. That's what we do. We make it as flexible as possible. You can do it via third party companies like Care Credit or Cherry. So there's different ways, there's different options, but I do think it's important, especially with how expensive things are, inflation, and if you're treating a child and there's siblings and there's multiple family members, parents also sometimes want to jump in and improve their smile too. I think it definitely gives some more versatility. It definitely makes things more comfortable. So I think it's important for sure. I agree.
Absolutely. I don't know anyone that makes an annual budget. Everyone makes a monthly budget for their family. So that makes a lot of sense. So I see on the website, you offer a lot of different options for orthodontic treatment, whether it be for adults or children. I saw on your website, I'm going to read this, you have clear aligners, you have the traditional metal braces, lingual, those are the behind the teeth braces, I believe, and Invisalign. So you have a lot of different options. So talk to me a little bit about some of those treatments and why you think it's important to have all these options for people based on their needs.
Sure. I think it's important to offer a wide variety of options. I think it's also important to know what you're offering in the sense of knowing how to use the appliances that you're offering. I think it's something where if you're doing something just to offer it, you don't know how to, but you don't know the pros and cons and the limitations of the appliances you're using. That's not good. So I think it's important to offer something and at the same time be an expert in it and really know how to work with the appliance. So we offer different appliances and it's also based on different lifestyles. Not every patient is the same, whether you're treating a 7-year-old, whether you're treating an 80-year-old or a 4-year-old, each one has different lifestyles, medical needs. All these appliances they definitely offer advantages to each of these things. So for example, fixed appliances or braces. This is something that's always on and that's always working on your teeth. For example, in a 7-year-old, it's very tough to trust a 7-year-old to really be on it and wearing Invisalign 22 hours a day. I think that's a pretty tall task. So something that's fixed on, like braces, would go a longer way and would be a more effective approach. Now, with these appliances, dentistry, orthodontics, as time goes by, things get more modernized. So now there's so many more custom way of doing things with 3D printing and 3D scanning, and that's what I take advantage of. Our practice is fully digital, so we offer not only aligners, which are custom made, but almost every appliance that we have, expanders, even some braces are custom made to the exact shape of the person's teeth. We have precise, contemporary, modern ways of doing things. We offer, for example, light force braces where, yes, it's braces that are fixed on the teeth, but they are made out of ceramic. So they're very aesthetic and they're also custom made to the exact shape of the person's teeth. So it's a very precise way of moving the teeth, and treatment a lot of times is faster. Invisalign, for example, is 3D it's custom-made aligners. So with Invisalign, the benefits is it's removable. You can take it in and out, so it's more hygienic. So Invisalign versus braces, Invisalign is a nice approach for someone with, let's say, dexterity issues or someone that may have a nickel allergy. Nickel is found in braces and braces wires. So Invisalign is a nice alternative to tackle the case without dealing with allergies or any dexterity issues. Each appliance has their pluses, of course. Each appliance has their minuses. But what's nice is that each type of appliance can fit a certain lifestyle.
Excellent. Yeah, it's funny how you talk about compliance with these things, and it's it's like the Shakespeare, "To thine own self be true." Like my wife got Invisalign, and she wore it every minute of the day that she was supposed to wear it, and it worked perfectly. But I know that if I got it, I would be that guy who wore it half the time, and it would be a waste. So I'd probably have to go for metal braces if given the option. But yeah, so it's interesting to see that approach.
Yeah. So to piggyback on on what you're saying, with your type of lifestyle, right? Aligners may not be the best option, even though you think all adults want aligners. I get that often, where people that are in sales or just naturally how they operate, you would feel more comfortable with braces. That's why it's important to, again, offer different options. And to piggyback on something else you said, one thing that is across the board that has to be met and that's important is compliance. Whether it's with aligners, whether it's with braces of whichever sort, compliance is key. That goes hand in hand with orthodontic treatment, where we can't get the result that we want. We depend on good compliance. The different appliances can help with that.
Absolutely. It's a partnership. It's a partnership between you and your orthodontist, and you both have to put the work in. So I read about you being a board certified orthodontist. So can you tell us a little bit about what that means? Is that how rare that is, and what's the extra training or certification that you went through to become board certified?
Sure. So not every orthodontist is board certified. So board certification is it's actually a voluntary process. So this is something that an orthodontist chooses to do, and it really demonstrates the orthodontist's expertise, and it also demonstrates the orthodontist's dedication to the field. So this is a voluntary process where when you finish your residency training, you choose to, at least how I did it, I know it works a little bit differently now ever since COVID, but how I did it was you actually have to fly to the American Board of Orthodontics, their headquarters in St. Louis, and you have a specific set of cases that you have to treat to a specific standard. And you fly to the board and you have to present your cases, and you analyze and dissect, and you are, again, in front of a panel of orthodontists that are on the board, and you're in different rooms, and you have to present your cases and explain how you treated the case, the different mechanics, and they ask you questions. So you really evaluate your case, and the case has to be treated to a specific standard. So that's how it was before. There's also before COVID, you had to also fly to St. Louis, and they would present and they would throw you in different scenarios. So they would present different cases at you, and you have to essentially explain how you're going to treat the case a specific way, and they pretty much analyze your approach, how you analyze the case. They assess your knowledge, and that's also how you get board certified. Now, I think because of COVID, it kind of shifted things a little bit. I think now it's an online exam that you have to take. But either way, it's a stringent process. It's a voluntary process, and you have to go above and beyond to study for this, to prepare for this, and you have to know how to treat cases to the highest standard.
Interesting. I think I read a stat. It was like the only 3%, because out there today you have orthodontists and dentists offering orthodontic treatment, but the statistic was only 3% of all the dentists in the country have become orthodontic board certified. So it seems like a no-brainer to me. If you're going to have braces or clear aligners done, you want to go to the top 3%. Go to the best. Yeah.
When you're choosing orthodontists and you look and see that if an orthodontist is board certified, you will know that they voluntarily went above and beyond, and they went through a very stressful, stringent process where a panel of orthodontists evaluated the work to the highest standard. So they are essentially they know how to treat to the highest standard of care.
Excellent. Excellent. So I was also reading that it seems that adult orthodontics is like the fastest growing segment, which makes sense because children's orthodontics has always been there and it's always going to be there. More and more adults are considering orthodontic treatment today. So in your opinion, based on what you hear in your practice, what's the most common objection you hear from adults about starting orthodontic treatment?
Well, yeah. So adults and orthodontics, I think even just kind of backing up a little bit and in general, I think with society now and how things are, obviously with social media and Instagram, I think aesthetics in general, whether it's orthodontics or people going to med spas and teeth care, skin care, I think all that is definitely it's more popular. People are looking more into it. People want to look good. Definitely with social media, there's almost like a reality of how people look and take care of themselves. So I think that's definitely a factor, what motivates or stimulates a person to take care of their teeth. And adult orthodontics has definitely come a long way. I think especially now with all these different treatment options, like you said before, lingual braces, aligners, there's now more aesthetic ways to treat orthodontic cases. So it's definitely more popular. I think from what you said, and I think that you answered it previously, what makes adults choose orthodontics or specific types of appliances. For example, I feel like a big objection to Invisalign, for example, is lifestyle, where a person, let's say, is in sales, right? And they're concerned about taking out these aligners all the time. They just tell me, Doc, you know what? I just want something on. I want to keep it simple. I want something on and working all the time. I don't want to worry about taking these aligners in and out. So I think it definitely comes down to the patient's lifestyle.
Definitely. And it's such an interesting thing with adults because it's an adult knows that they want to be more confident with their smile and feel better about their smile. But it's not until you do it that you realize the daily return on investment you're going to get from that, where every day you go out and you smile more confidently and you build your confidence so much that, it's hard to make the leap until you've actually done it to understand that.
Yeah. I know that you mentioned to me that your wife had Invisalign.
Mm-hmm.
And then what would make you decide that you would rather do braces versus Invisalign, even though it's not the most aesthetic approach?
The compliance factor.
Yeah.
Knowing that I would probably be the guy who forgot to put them in. And because I've got a million other things in my brain all the time. So I'd be the guy that left them on the sink and didn't put them in. So yeah, for me, it would be I understand what you're saying about the lifestyle and knowing that, whether it's traditional braces or lingual braces, that they're there and they're working efficiently all the time and I don't have to think about it.
Yeah. And also I have patients that come in that had braces before. They know the experience, they know what it felt like, and they want to do something different. Where I've had patients where they had Invisalign treatment before, and for some reason they're not happy with how it went, or they feel like for them it didn't work, and they want to go a different route. So that's where I think offering different types of options goes a very long way.
Excellent. Well, thank you so much for your time today. I really appreciate it. It's been a great conversation. And do you mind just giving people letting people know how they can find you online?
Sure. Well, thank you, Ben, first and foremost for having me, for, taking the time again to have this conversation. It was a pleasure. You can find me on our Instagram handle at MHROrtho. You can find us on our website, www.mhrortho.com. Our phone number is 732-704-5474. We are located.
Absolutely. And I could say that I work with several general dentists in that area up there in New Jersey and around Rumson, Red Bank, all those places. And I know that they all refer their patients to you for the orthodontic work. So that's a great testament to what you guys do there. Once again, thank you so much for your time and for being here with us. I really appreciate it. And good luck to everything you're doing, especially raising those young 5-month-old twins.
Thank you for joining us for this Dental Flow podcast episode. If you enjoyed today's discussion and wish to stay updated on future episodes, please like, subscribe, and share the podcast with colleagues and friends. For more insights and discussions on dental marketing, we encourage you to continue riding the Dental Flow wave and tune into the next episode. Keep on smiling, learning, and flowing with the Dental Flow podcast.